exercises. Now we're going to work on elevating your shoulder to increase your range of motion. And then you're going to say something like, let's do some PNF stretching today. And they're going to be like, what's PNF mean? And then you're going to say, oh, it stands for proprioceptive neuromuscular facilitation. And they're going to be like, whoa, what is that? So I would say my first tip is to develop a strategy to answer that question to your patient. What is proprioceptive neuromuscular facilitation? Because they're going to ask you. And basically what we're trying to do is we're trying to kind of tap into our innate programming. Our neuromuscular system is programmed to perform certain movements, and what works out nicely is it correlates to function, particularly in the upper extremity, right? So the big difference with PNF diagonals of the upper extremity is because we don't normally do a lot of things without visually tracking our arms, is we tend to encourage our patient to visually track their arm so that we can reprogram the visual system in line with the use of the upper arm. In other words, we typically have the patient watch their hand as they move because that correlates to what they're going to have to do when they return to function. That's the big difference. As you may recall from before, we have strategies on how to remember the different diagonals. So for D1 of the lower body, first you're hanging out, and then second you're crawling home. Yeah. So for this one, you feed yourself first, and then you go out and party later. So you have to eat first before you go have fun. So for D1, it's very similar to things like eating. Maybe putting on a seatbelt. People have trouble reaching across and putting their seatbelt on their driver's side. What's another example of another one that people do? I don't know, I can't remember. But basically it has a lot to do with feeding, grooming, brushing your teeth. You're doing a lot of D1 flexion, right? A lot of this. The second one is D2, and it's very similar to like kind of drawing out your sword. I always tell the patient, draw your sword out and release the dove. Draw your sword out and release the dove. So this is something more like, again, doing things like putting your seatbelt on the passenger side, but things like pulling a lawnmower cord, something like that, where someone's pulling out and away. What's another example I was thinking of earlier? I had someone do for that one. I don't know, a lot of people who dislocate have trouble going out here into this 90 degrees of abduction and external rotation position. So we do a lot of persistent PNF D2 diagonal to give them stability through a dynamic range going up and out. So like if they were throwing, people have to clean underneath their armpit and things like that. So whenever they go into this dangerous position, post-surgically or after a dislocation that's treated conservatively, we do resisted work out in this direction. So, feed yourself first, party second. So, I should have pulled up the, you finished already? I'm going to fire you up next. You can just listen and we'll practice. How much do you have? 2